Hi, everyone. Thank you for joining us this afternoon or this morning. If you're joining us via Facebook Live, however you're tuning in, thank you so much. And this is the Health Equity No Matter Where You Live Roundtable. My name is Jaima Crespo. I'm an investigative consumer reporter at Telemundo 62, and I'll be your moderator today. This is our panelist, but let me give you a little brief introduction of what this roundtable is about. So the Health Equity No Matter Where You Live, it's presented by Aldea and the American Heart Association, sponsored by Mainline Health. And we'll focus on how community members and organizations like the American Heart Association are working to eliminate racial bias in healthcare and support initiatives and legislation that will provide everyone in Philadelphia the opportunity to live a long and healthy life. And also you're gonna learn about the American Heart Association's mission, its initiatives to increase health equity, how physicians can better help their patients, and how community organizations work to support under-resourced neighborhoods, and the evolution of philanthropy to address the short and long-term needs. So that's a brief introduction. And now I'm going to introduce our panelists. Today we have Dr. William Gray, System Chief, Division of Cardiovascular Disease at Mainline Health, Director of Lancano Heart Institute, Chairman of the American Heart Association in Philadelphia. Also joining us, Judy Emmons, Director of Primary Care at Congreso Latinos Unidos, Dr. Aditi Kala, Assistant Professor of Clinical Medicine at Lewis Katz School of Medicine at Temple University, and Reverend Dr. Lorena Marshall Blake, President of Independence Blue Cross Foundation and VP of Community Affairs of Independence Blue Cross. Thank you all of you for being here today. This is a really important discussion, conversation, a lot of good information here today. So let me begin with you, Dr. Gray. As a cardiologist and volunteer board president of the American Heart Association in Southeastern Pennsylvania, can you speak to the group about the impact that health equity may have on a community and how the social determinants like access to healthy food and quality healthcare can have a long-term effects on a person's quality of health and even lifespan?
Absolutely. Well, thanks, Jaima, and thanks for pulling this together and putting this front and center. It's a very important topic, and as the audience will see, a lot of work is being done to address it. In Philadelphia, we see not only disparities based on zip code, but also based on race and ethnicity. In the Black and Hispanic and Latinx populations in Philadelphia, we are seeing significantly higher rates of smoking, sugary drink consumption, and consumption of foods high in sodium and saturated fats. I think everybody understands that these are unhealthy behaviors, and they result in hypertension, type 2 diabetes accompanied by obesity, and can ultimately lead to heart disease, as these are the major risk factors for both heart disease and stroke. However, I want to make it clear that these are health-related decisions are often not made by choice, but are determined by the lack of access and the opportunity to make healthy choices. Neighborhoods in North and West Philadelphia are adversely affected by the lack of access to healthy food, unhealthy housing conditions, and other social determinants of health. And actually, these things are even more expansive than I'm talking about today, and we're discovering new social determinants of health almost monthly. These factors, on top of daily stressors and trauma experienced in many of these neighborhoods, have led the AHA to give special attention to the populations living in these parts of the city. Black, Hispanic, and Latino populations are more likely to experience hospitalizations due to complications related to the coronavirus. And I think everybody has seen that in the news over the last year and a half or so. The health impact will not only be felt in the present moment, but as many people know, the economic impact caused by the pandemic will result in more unfavorable health conditions. So it builds on an already unfavorable set of conditions. So if in the future we don't address the social determinants of health now and in the future, it's just going to continue to snowball. So it's a very important subject we're here to talk about today.
And Dr. Gray, before I go to the next question, if anyone has a question, we will have a section later on and we will address, so anyone who wants to send in a question, they can do that. And my next question, Doctor, how is the American Heart Association working to address the issues that you just brought up, and what types of changes are needed to undo policies and structures that exist that keep a community from thriving?
Well, it's a complicated question, as you can imagine, Aima. These are things that did not occur overnight. They're going to take time and a lot of effort and insight to unwind. But the American Heart Association has made several efforts to start that process and actually has already delivered on a lot of the key goals. So I'm just going to tick off a few of them. As we looked at the 2020 impact goals for the AHA, which was to decrease mortality from heart disease and stroke by 20% and improve the health of all Americans, not just Americans in wealthy zip codes, by 20%. We monitored key prevention indicators, which included hypertension, unhealthy weight gain, and smoking status. And these key indicators and overall cardiovascular outcomes showed correlation with a lower socioeconomic status, lower education level, and education income and occupation in general. So we've already kind of laid out and identified the problem, or at least a descriptive part of the problem. And these trends made it clear to us that the need to address the health impact of these conditions in which people work, live, play, and pray also led us to our presidential advisory in 2015, stating that, in no uncertain terms, the social determinants, the circumstances in which people are born, grow, live, work, and age, are fundamental causes of cardiovascular health that occur over the lifetime of the person, and the failure to address them will compromise the AHA goal to decrease cardiovascular mortality and improve ideal cardiovascular health. That's a big statement. That's something that, you know, we can continue to pound on hypertension, diabetes, weight control, healthy living, exercise, and so on. But if we don't recognize what the limitations that the people we're speaking to have in kind of engaging those recommendations, then we've failed. And so I think this is a very important statement and an important insight that this AHA has come to, and now 6 years old. Mainline Health, where I work, and the AHA are working to build community clinical linkages to address hypertension and to make connections in clinical care alongside the trusted community settings like faith-based organizations and the barbershops. You may know that there's a barbershop study that showed that communication within a barbershop is about as robust as you can imagine in communities where they're important gathering places. The AHA also works alongside primary care providers within the health systems like Mainline Health and federally qualified health centers to improve the standards of care, expand patient education, and address barriers caused by the social determinants of health. The AHA has also prioritized the evidence-based concept of patients self-monitoring of blood pressure at home to assist the accurate diagnosis and management of hypertension. This home monitoring, it has not only effects on the patient because they now become educated about their health and their awareness about their health, but it also educates the family and their extended contacts because people see the children, the grown-ups, everybody sees the care and the blood pressure measurement that's going on at the home. So this has wide-ranging effects. In addition to the work that is being done in the community and clinical setting, the AHA also advocates for longer-term solutions. So in addition to these short-term and more immediate things, which are important, we're looking to expand health plan coverage for blood pressure cuffs and work further upstream by collaborating with city governments, large employers, and the food industry to limit sodium content in foods, sugary beverages, and other examples like that. So a lot of things happening at the AHA. It's an important effort, not just in the short term, but looking down the road to achieve the long-term goals of the AHA to improve health for everyone.
Thank you, Dr. Gray. Before I move on and I toss it over to Judy Emmons, does anybody, any of our panelists want to add anything to the conversation?
This is Lorena. The one thing, and I totally agree with Dr. Gray when he talks about barbershops, okay, and the faith-based community, because recently we just launched an initiative dealing with the faith-based community, and I will talk about it, but they are such, I often think of trusted messengers. And if you've ever been in a barbershop, It's amazing. It's not necessarily a place for women, but we can go to beauty shop. But same thing. In other words, you have to meet people where they are and have that conversation. So I applaud you, Dr. Gray, and as you move forward and do that, because you got to go where the people are as opposed to where you want them to be. But barbershops and faith-based community are great places. So that's a yes. Okay. I just
more, Lorena. Thank you.
You're welcome.
And even vaccinations now, right? They're gonna try to push vaccinations at the.
We just launched it. Exactly, Yamima.
Great. So now I'm gonna toss it over to Judy Emmons. I do have a couple of questions for you. You're the Director of Primary Care at Congreso de Latinos Unidos. So my question to you is, can you discuss some of the challenges facing Congreso's patient population?
Sure. Thank you for having me. I want to start by saying that Latinos in Philadelphia reside most densely in Congreso's Eastern North Philadelphia community, and they experience a myriad of health disparities. The zip code that Congreso is located in, 19133, is considered one of the poorest zip codes in Philadelphia. And the majority of families that Congreso serves are living at or below the federal poverty line. What that means is that a family of 4 is earning less than $27,000 annually, and in many cases, it's much less. According to Philadelphia data, Latinos in our city are more likely than non-Hispanic whites to report poor and fair health, experience obesity during childhood, be diagnosed with diabetes, be diagnosed with HIV, be hospitalized for asthma, be diagnosed with a mental health condition, lack access to healthy food, lack prenatal care, experience low birth weight or infant mortality, and lack health insurance or avoid medical care due to costs. We know that Latinos are disproportionately affected by the social determinants of health, which impact long-term physical and mental health outcomes. They're less likely to be proficient in English by the 4th grade, graduate from high school on time, and complete college before the age of 25. They're also more likely to be unemployed, live in poverty, be victims of violence such as homicide or domestic violence. Congreso's community also has the most drug-related overdoses in the city. These health disparities result from and are exacerbated by historical and ongoing systemic inequities. Latinos and other communities of color in Philadelphia experience a lack of financial resources, inadequate and unaffordable housing, high rates of unemployment and poverty, and limited access to physical and mental health care.
Thank you, Judy. And we cover that community quite a lot. That's our community, or Hispanic, meaning Spanish speakers in that community as well. So how is Congreso working to address these challenges, and how is the organization's holistic approach of managing the social and emotional as well as the physical needs of the community? How is that work helping the community essentially?
Yeah, and Congreso has been doing this work in Eastern North Philadelphia since 1977. So for almost 40 years, we've been a trusted partner in the community, and folks know that they can come to us for services and for help. Right now, we have a womb to work strategy that we call Mission to Impact. And really, we base this on our 5 pillars of health, housing, education, workforce development, and parenting. And this enables our patients and our families that we serve to achieve independence, well-being, and long-term success. One of the strengths of our Mission to Impact strategy is that it emphasizes that individuals and families exist in an environment that can either help or hinder their well-being. So we designed Mission to Impact to recognize that the environment influences individuals and families, and we intentionally align our services to be able to alleviate negative health outcomes and emphasize positive environmental influences. The Congreso Health Center offers primary care, HIV care, sexual and reproductive health care, regardless of insurance status or documentation. And our staff work to connect patients with supports that reduce health disparities and promote long-term well-being by addressing the social and environmental conditions. These supports include integrated behavioral health services, on-site drug and alcohol assistance, including Suboxone and Vivitrol, weekly nutrition classes for our patients who are at risk of diabetes or hypertension, an on-site social worker who supports patients with enrolling in Medicaid and emergency medical assistance, a referral coordinator who assists with navigation of medical services and specialty care, as well as internal referrals to Congresso's programming, which includes our Latina domestic violence program, HIV and AIDS programming, housing services, parenting classes, education and workforce support, such as GED classes, career training programs, and entitlement services that help address needs like utility assistance. By addressing multiple social needs for patients and not just their physical health needs, we're able to promote equity and ensure that our patients have success in achieving their long-term health goals. In March, Congresso also opened a daily COVID-19 vaccine clinic within our FQHC, which we're really proud of. And this is in addition to the COVID-19 testing services that we still offer. And this helps to remove barriers to accessing the vaccine for patients and the larger community. To date, we've administered over 4,000 vaccines in our community, and this community actually has one of the lowest vaccine rates in the city. So this further emphasizes the need for Congresso to provide this critical service.
And Judy, before I move on to the next question, the primary issue that at least I've found as a reporter, as a journalist, when it comes to the Latino community, and especially during the vaccine distribution, is the misinformation that's out there and myths. And how is Congreso helping that community and sort of teaching them that getting vaccinated is important to ending the pandemic?
Yeah, we're doing this in a lot of different ways. We actually have a partnership with Unidos US right now. And with that, we are developing focus groups and hiring promotoras from the community to really support vaccine hesitancy, to help folks understand why they received the vaccine and to break down those barriers. We're also doing a lot of surveys with our patients who are getting the vaccine to really understand what fears did they have? Why did they decide to get the vaccine? Was there someone in their life that influenced them? We're using that data to really target our messaging to the folks who still might be vaccine hesitant right now. We're actually sharing that data as well with the Department of Public Health in the city, and making sure that everyone really understands what those barriers are, what folks are talking about in the community, and what we can do to address the vaccine hesitancy.
Yamima, can I jump in one more time?
Yeah, absolutely. Go ahead. Yes, yes.
Again, as Judy's talking about everything that Congreso is doing, there's also an organization that's it's called CATE, Community Access to Testing and Education, that has partnered with them, and it's all about doing education, because I think that's the key, and also vaccine, specifically a guy by the name of George Fernandez with the Latinx community. And I think I'm ahead of myself again, but I think it's so important from a philanthropic standpoint that we who can assist with dollars. I mean, Congreso, we love them, are one of our clinics that we support, and we didn't just do it, we've been doing it. So again, getting on the front end and that whole prevention, and when you look at the whole list of everything that Congreso is doing, it's like, wow, and that's what's needed. They are literally boots on the ground, making a difference, being there for the community. So I'm excited from a philanthropic standpoint that we can partner with them in playing their mission forward. So I didn't mean to jump in again, but I did mean to jump in again, okay? Because we love you. Okay.
Thank you, Lavina. We appreciate your support.
Well, we love you guys. You do good work, okay?
And Judy, precisely what Lorena was saying, how important is it to have those partnerships and collaboration with the American Heart Association, with Independence Blue Cross, that there's a need in the community, but you also need that support to be able to get the help to the people that need it most.
Yeah. And as a federally qualified health center, we serve patients regardless of their insurance status or their ability to pay. Oftentimes that means we're not able to bill for the primary care services that we're providing to our patients, but we're still doing them. So what that means is we need help from our partners like IBX Foundation, like American Heart Association, to really add, in those programs that are really, crucial to our patient success. And also, our patients need a lot more than, patients, in the suburbs. The folks that we're serving have a lot of complex social needs. And so providing just general primary care to them and sending them on their way isn't necessarily the solution here. We have folks who are coming to us with a history of trauma, with a history of domestic violence, who have inadequate housing, as Dr. Cray said, who have food insecurity. And these are real things that impact their ability to control their diabetes, their hypertension, their HIV. When you have priorities like that, you're not necessarily concentrating on taking your medicine every day. You might not have access to a pharmacy where you can get your medicine. And so there's a lot of different things that we do. And most recently, Congresso actually just opened an on-site pharmacy within our FQHC to really be able to support our patients with accessing their medications, either free or at a low cost for patients who are uninsured or underinsured. So that's something, things like that are just really kind of targeting these social determinants of health and really removing those barriers to care.
Naima, I want to just say that, Judy and Congresso are doing the work that the AHA thinks is critical, but without them, we can't do it. They're a trusted organization. They have, as Lorena said, they have boots on the ground. The AHA has only so many personnel resources, and working with people like Congresso is so critical to getting the messaging out and some of these strategies and tactics into the communities.
Yeah.
Thanks for what you do, Judy.
Yeah. And again, Doc, I think that just emphasizes the importance of partnerships, that no one of us can do it. But if we all join hands, hearts, and take our resources and put them to the table, we're able to, may not be all happen one time, but incrementally things will start to change. And it didn't happen overnight. It's not going to change overnight, but it's just being very purposeful and just intentional. So again, I think just great partners.
And one of the programs that our clinic is most proud of, and one of our most successful programs, was actually funded through the American Heart Association, called Eat to Live. And this was a pilot program that we did in 2018, where we actually targeted our uncontrolled diabetic patients, uncontrolled hypertensives, and we provided them not only with mental health supports to overcome a lot of the barriers that they were facing to controlling their physical conditions, but also we provided them with monthly food baskets and nutrition resources. And we saw, really great progress in these patients that we targeted, and we had 73% saw a decrease in their systolic or diastolic blood pressure, and 45% lost weight and reduced their BMI. So we really considered that a success, and it really just shows how, putting those supports in for patients and really addressing those social determinants can help those physical outcomes really become more better.
Great.
Definitely our community, like you said, they need the resources and they need a place to go get it. And sometimes also there's a language barrier for Spanish speakers. And that's why the work that you do at Congresso is so important as well. So let me toss it over to Dr. Aditi Kala. Let me just introduce you once again, Assistant Professor of Clinical Medicine at Lewis Katz School of Medicine at Temple University. So doctor, how can representation in research help address cultural differences when treating a patient?
Yeah, absolutely. So, it's interesting, in recent years in the US, certain populations have really grown exponentially, and specifically looking at Latin Americans, East Asians, and South Asians. And with those increasing numbers, physicians and scientists alike have had this amazing opportunity now to enroll people who were previously underrepresented in research. And with that, in turn, we've been able to recognize which populations are actually at higher risk of heart disease, because the face of heart disease used to look one way, and we're realizing maybe there are more faces to this. We now understand that the African American, Latin American, and South Asian populations tend to have the highest rates of heart disease. But what I personally have found the most interesting is that with the increasing populations, and now having people from those communities who are involved in conducting the research, so both between the numbers game and that unique insight into your own community, we're able to really kind of get a better understanding as to what are the risk factors specifically for that community that's increasing their rate of heart disease. Just to give you an example, we found that hypertension is a lot more prevalent in African American and South Asian communities, and it tends to occur at a much younger age. As Judy mentioned, diabetes is a big risk factor in the Latin American population. Also, physical exercise, much lower in the South Asian and Latin American populations. So, whether it's a genetic or it's a cultural risk factor, knowing what it is as a physician, what I need to target, if it's to prevent, screening to begin with, so I can maybe even prevent heart disease, or at least in my patients who are already affected, what is it that maybe for them I may need to be more aggressive? Knowing what those targets are, it's not a one-size-fits-all situation. Getting to tailor that to my patient it's a game changer. So,
and so doctor, so how do you know the factors, right? You've done the study and you know that this happens more prevalent on certain communities. Why is this happening? Is it because of a lack of information, lower incomes, less access to healthy food?
I think it's sort of a double hit phenomenon. I think there's definitely a genetic component to this. We do see that, especially South Asians, for example, we have much higher rates of cholesterol, and we think it's a genetic abnormality. Again, high blood pressure tends to run a lot more in people of African, Latin, or South Asian descent. So there is definitely a portion of it that's genetic. And then, as Judy has brought up, and Dr. Gray, there's environmental factors that don't help out. So educating people on those on their lifestyle choices is super helpful. We all can already explain, listen, unfortunately, you're not set up to do well from a genetic standpoint. But I think to me, what's been the biggest difference is screening. Because previously we used to think that the right age to start screening for things like high cholesterol and high blood pressure was at the age of 35, unless you had like a clear factor. And we're learning that's not true. For a lot of these populations, we need to start screening at the age of even 8 years old. I mean, based on this research, FDA has actually now approved cholesterol medicines to be started at the age of 8 years old, because they've shown now with research that you really reduce the chance of these kids later on developing heart disease by a very significant amount. So kind of both things, I think.
So in terms of understanding this further, how is a patient's, for example, homework or their environment plays a role into all of this, plays a role into heart disease and potentially maybe preventing it if you change your lifestyle?
Right. Yeah, that's a great question. So, for me, it's been interesting. I did my training, and I'm currently practicing now in the North Philadelphia area and Northeast Philadelphia. So, a lot of my patients live in the areas that Dr. Gray previously mentioned, where it's kind of what we call a food desert. Your greatest access to food often becomes convenience stores that are at every corner. And they predominantly do sell high-calorie snacks, and they sell a lot of tobacco products. There's research that's been done based on health-related behaviors, and often they're responding unconsciously to these environmental cues. And unfortunately, when they respond to these cues and maybe don't make the healthiest decisions, that often ends up leading to them getting readmitted to the hospital. And the problem is, every time you get readmitted, your mortality rate continues to go up. And so that cycle continues. And I think, just to sort of answer your question as to what can I potentially do with it, I think as a cardiologist, I personally feel responsible that part of my job is to understand what their environment is. It's not just about understanding what their medical condition is inside the hospital, it's understanding their environment outside of the hospital. Because if I can figure out for that patient what's their particular cue or their particular limitation, then maybe I can sit with them and we can create a better plan to kind of help combat some of these things. And by that, I mean, it's very easy as a healthcare provider to get frustrated when your patient continues to smoke, for example, but providing that non-judgmental support for tobacco dependence, I think it's key. I think understanding, I used to in the beginning when I first started my training, I was like, okay, no hydrogenated oils. This does not translate, understanding that often you're going to be going to a convenience store when you're hungry to grab a snack, but what's a potentially healthier snack that's available at these convenience stores? If you don't have access to gyms and you don't have access to public parks, what home workouts can we do to help, lose weight? There are, setting those little goals with the patient while they're in the hospital. To me, I think that's the key to breaking the cycle, for one, and for two, kind of bridging that gap between hospital discharge and then heart healthy ever after. And one thing I want to echo that Dr. Gray mentioned, I have noticed often when my patients come back to see me in the office, because we've sort of reinforced some of these lifestyle changes they can make. Again, small incremental changes that they can choose to make. It's interesting how often their family members become very hyper aware of their own lifestyle choices. So in my mind, and I may be full of myself, but I'm hoping that my impact therefore goes further. I create a healthier patient, I create a healthier family, and hopefully create a healthier community. So that's my goal.
Yeah.
Go ahead, Janina. Go ahead.
No, I was gonna go back also to the you brought up children and that the fact that at 8 years old you're having to sort of go get this prescription drug or medicine to give to your child, and you said that once you're, for example, if a parent changes their lifestyle, that can also translate how you raise your child, right? So how important is that a parent is aware that their eating habits or their lifestyle impacts their children?
It's paramount, because the problem is once you've already developed heart disease, you already have caused some amount of damage, and now that's not going to be easily reversible. But if we can prevent that to begin with, my gosh, your life changes completely. And when we have a healthier community, we have a better chance of doing a lot of the social things that Judy mentioned. Employment, being able to financially afford better homes, and being able to get out of that cycle of where you're constantly enamored by things that are not healthy again. So I think, again, it's just, to me, I see it as a cycle that I want to break.
Yeah.
And Lorena, you wanted to add?
Yeah, no, I'm just in agreement with everything that has been said. And I think, again, especially for communities of color, when you talk about research, there are always those stigmas or the hesitancy with regard to participating because of historically things that have happened. But I think, again, as I hear Dr. Gray and I hear Dr. Didi in talking about that whole cultural competency, if you've seen one community, you've seen one community. You can't overlap or overlay the same thing on everybody. So again, when I even look at Congreso or others that are out there, what is it? It's not, everybody is not the same. So the same one solution for one may not be that solution for another. So I think it's getting creative and really, again, getting to know. I'm going to laugh. There's a song years ago called Getting to Know You, Getting to Know All About You. I'm dating myself when I'm with you. Doc, you might know this one, getting to know what to say. Again, getting to know the community that you're in. So you know what to say and you know what to do. And you come in, I think as Dr. D said, non-judgmental, okay? No judgment, no judgment. So I'm just in agreement, that's all.
Dr. D, is there anything I didn't ask you that you think is important to add to what you were mentioning in regards to lifestyle per se, and how we can make changes to make sure we don't, end up in the hospital with some illness?
You mean specifically any tips or hints that I have?
Yeah, like anything else that you would like to add, or because I'm gonna ask Reverend Dr. Lorena a couple of questions, but I don't want to move on if you don't want to add it.
Yeah, no, I appreciate the opportunity. So yeah, again, the things that I try to emphasize the most with my patients in the office is our goal from a diet perspective. Again, it's cumbersome always to read all the to read all the labels, but we're aiming for a higher protein diet, a little bit of a more complex carbohydrate type of diet. So just to give you an example, I have a patient who, again, her usual snack is to go get a bag of chips, and we've switched that over to a bag of mixed nuts. It's higher protein, it's a little less sodium. So just minor changes like that, it's surprising how much of a difference that can make. A lot of my patients used to stop exercising when they got out of breath, but it's once you got out of breath that you hit your anaerobic stage and you're most likely to start actually losing weight. So again, just some of the stuff is known, it's just a matter of reinforcement. Some of it, maybe I can have the opportunity to provide some new education. So yeah.
Perfect. Thank you, doctor. So now I'm going to toss it over to Reverend Dr. Lorena Marshall-Blake. I want to introduce you again, President of Independence Blue Cross and VP of Community Affairs. So I want to start by asking you a question that it's coming up more and more. And I think during the pandemic, we saw this rise in mental health illness. and which the numbers are quite alarming. And Independence Blue Cross is doing an amazing campaign, and we've worked with them as well here to try to get the message out. How is the foundation exactly helping and getting the message out to people that if you're going through this, there's help?
Yeah, let me, and thanks again, Unique, for the opportunity to do this. I'm just real excited about getting the information out. Quickly, again, I have to talk about how the foundation, we've been around for, gosh, it's our 10-year anniversary, and with the intent of leading sustainable solutions to improve the health and well-being of our community. And I think that's a key word, community, and it's everybody, okay? And again, that what we're doing, we're more, people say, oh, you're a grant making organization. Hey, we're more than a check, as I often say. But when I look at, we are conveners, we are connectors, and mental health, getting to your question, is one of the most challenging healthcare problems, not just here in our city, our state, but I believe in the nation. And even before COVID, it's been said that 1 in 5 Americans experience a mental health illness. And this is an area where we think the foundation that we can make a meaningful difference. And just last week, I'm excited. Last week, we had a press conference where we announced an exciting new partnership with CHOP, Children's Hospital, with their Department of Child and Adolescent Psychiatry and Behavioral Health Sciences, and Girard College Achievement Team to offer telehealth behavioral health to Girard College's 300 students. And let me tell you why. 80% of their Girard students had some type of traumatic childhood experience, such as depression, family violence. And again, these things have been mentioned: substance abuse, incarceration, homelessness. And again, never has there been a more critical time, I believe, to recognize that mental health is important. Again, JAMA has even put out half of the children with a mental health condition in the United States go without treatment. And I think it's only emphasizing what everyone is here saying. And especially youth from underserved communities are less likely to receive mental health care. And again, mental health issues have been, I think, and it's been said, exacerbated by COVID-19. It has only made it worse, especially true for kids. Their lives have been greatly upended by school closures, family stress, social isolation, and yes, economic changes. But this has always been a national issue affecting our communities, and one of the foundations sought out to address to quite some time. Again, mental health issues first arise in childhood, and I think we've talked about if you aren't able to nip it in the bud early, it goes right into adulthood. But research shows, and Dr. Didi, thank you, research shows that intervening early when the signs of risk first emerge can reduce both the likelihood and severity of mental health disorders and other disorders in the long term. Foundation is leading another initiative to improve mental health. And this is for our healthcare workers, those who are on the front line. I say, is there a nurse in the house who are overworked and fatigued by the pandemic, building on our longstanding support of nurses? So we're on the front line working with them in an effort to see how we can alleviate the stresses that they deal with on a daily basis. And the pandemic, and unlike they've ever experienced before. And for so many, this has taken quite a toll. So we're right in the midst of it, trying to make sure that those essential workers like the nurses and others that are out there have the mental health needs, have what they need when they need it. And they shouldn't have to wait until it happens. And then we're all scurrying to trying to figure out what we're going to do. But this whole mental health piece has been, but it makes my heart beat in finding ways and innovative ways to address it, so that not just the children, but the whole, what I call equitable health for the whole entire family. So often you're not just treating the child, you're treating the family too. And I think that's been emphasized throughout the conversation today, that you've got to work with everybody together in an effort to address whether it's high blood pressure, chronic heart disease, or whatever that may be. So, but it's all about your mental health. And because we say you are what you eat, but you also are what you think. So you have to make sure that you address that to some degree also.
And Reverend, if you can, I think you brought up stigma and you've brought up no judgment. I think Dr. Kyle also brought that up. But when it comes to mental health, there's just a lot of stigma around mental health, right? And
Right.
how do you address that? How do you get that message out into the community? And how do you change minds about mental health?
And and I'll say it's easier said than done. Okay, there are a couple things that we do on the corporate side. It's that mindful Philadelphia, that's part of it. But more importantly, I go back to boots on the ground. It makes me think of as one of the programs we have that's called STOP, Supporting Treatment and Overdose Prevention, which deals with the whole challenges with regard to the opioid situation. And again, taking away the stigma. See, I think that's key. In other words, it's okay not to be okay. And I think it's emphasizing with folks that it's okay. And if you're going through a challenging time, guess what? We are here for you. There are supports in place to make sure that that happens. Whether, again, when you look, I go back to whether it's Congreso and the other 60 clinics that we support, behavioral health is key. Because I see Judy shaking her head. So again, it's dealing with that. And again, from a philanthropic standpoint, and it's not always about putting money in it, but again, in order to get the services and get the staff and folks in there that you need, there need to be dollars there for it. So I'm not the expert, but I know whether it's Congreso, Spectrum, and other clinics, they are the experts. So again, and they're dealing with people where they live because they're right there. I go back to the big word is community. And again, helping everybody to get together in an effort to do that. And again, I get excited from a cultural standpoint. There's Congreso, there's Philip Jozon and Spectrum, to name a few, who help increase access to vulnerable communities. So again, I tell people, I don't want to just date you. I want a marriage. So I want to work with them. People have heard me say that. But again, we are a partner because when you're good, we're good. Okay. It's like, don't tell me you care, show me you care. Okay. So again, I think through the foundation, we've been able to show people that we care. Even when we look at, you had mentioned something earlier, Mima, with regard to the vaccine. With the faith-based community. And we just kicked off another campaign last week. It's the All Faith Vaccine Campaign, with an effort to get communities of color through their faith-based institutions to get them vaccinated. So again, we've got to use the supports that are there in place, and going back to trusted messages, trusted messengers. So again, and it's, again, knowing my lane. I know what I can do and I know what I can't do. But I know there are partners out there that if we, what is, for lack of a better word, surround the wagons, we can get some movement on it.
And to piggyback off of that, Lorena, the Independence Blue Cross Foundation actually supported Congreso in launching our integrated behavioral health services a few years back. And what that is having an on-site licensed clinical social worker within our primary care clinic who's really meeting our patients where they're at, taking away the stigma of accessing mental health services, making it so much easier for a warm handoff from the medical provider to the BHC, as well as, just removing those barriers to accessing mental health, and really kind of changing how mental health is thought about. We tend to think of depression and anxiety, which yes, it is, but it also includes removing barriers to, controlling your chronic condition like diabetes or hypertension. Oftentimes there are things that, our licensed clinical social workers can really work with the patients to remove those barriers and really help improve their physical health, which in turn improves their mental health as well.
Exactly.
I'm going to open it up to questions. We have a couple of questions, and you can all jump in and answer this one. I think we touched on it, but this one's more specific. It says, can the food service industry, supermercados and bodegas, so supermarkets and corner stores, be the missing partner in the team approach to deal with all these chronic diseases?
Okay.
I don't know if Dr. Gala wants to jump in.
Go ahead, Doc.
I think they absolutely can be. It's interesting. There was a study that was done where all they simply did is, in a vending machine, they changed it so that what's at eye level is actually water or, some low calorie things, and higher calorie things were outside of eye level. And that intervention alone reduced the amount of times that people purchased high calorie things significantly. So yes, I think they absolutely could be a partner. I think whoever came up with the question just brought us a really good idea. So I think, yes.
Yeah, there's actually been President Clinton, after he left office, engaged in a big project at vending machines in schools. And he went after the people who stock those machines. And there was a resistance because, as you can imagine, sweet things sell pretty quickly. But he was successful enabling a change in the vendor mix of what was in those machines. It's hard to get something excessively healthy out of a vending machine, but it was an improvement. There were nuts and things like that rather than candied sugars and chips and things like that. So that's been recognized as a major contributor, and the food service industry, so to speak, can clearly play a role, and we have to engage them more to do so.
One of the ones that it was matter of fact, it was a initiative last summer, and it's going to happen again this summer through Aramark, where they are working again through the churches. And I know at my own church, we were able to provide 200 meals a day, breakfast and lunch, for children that were healthy. That went from I think it went from July to the end of August, because remember the schools closed. So you wanted to make sure. So and they're doing it again this year. So it has, it has fruit, it has, it has milk, it has juice, and again, nuts. Okay. So again, putting things in there that are healthy snacks. So again, Aramark, I know, is doing, and they're partnering with the Urban League of Philadelphia. There goes another partnership that's out there that's being done through the churches in an effort to get food out also. So that's something that's coming. And matter of fact, it will start July 1, but they did it last year, and it was they did over 500,000 meals. It's been incredible. So again, they're building on that again this year. So that's another partnership that is out there, and it's with the food industry.
And Yaima, I think, it's also relevant that there have been multiple studies looking at this that have shown that when given a choice between healthy produce and junk food, people will choose healthy produce if it's given to them or it's put in front of them or supplied to them. So these food deserts become really meaningful issues, because when you don't give the option to people to get the healthy food that they actually will select on their own, it becomes a major issue. So again, to the point about how much the food suppliers and food service industry can help in this, it's very meaningful.
I think then too, many of again, I go back to the churches again, Monday, Wednesday, and Friday, we have fresh produce, whether it's zucchini, green peppers, onions, peanut butter, healthy, that we put together and we provide for the community at the Vine Memorial Baptist Church from they're from 9 until noon. But again, back to Doc's point, that healthy food, not just snacks, but real stuff that makes sense, that's protein, that has substance. So, and even you have Share, you have a couple of them that are doing that, and I know even ShopRite is doing some things. So they're getting there. With regard to that. Mm-mm.
I believe American Heart Association even partnered with Aramark.
Yes.
That.
There you go, Dee.
Yeah.
And I agree, access is so important. And what we found with our Eat to Live program was that when we provided folks with those monthly produce baskets, they were using it and they were excited, and it brought them back. It was an incentive to stay in the program. And we also, gave them the tools and the resources they needed to understand how to cook and use those foods, because some folks hadn't seen those things before, or didn't quite know what to do with them. So that was really important to that education piece. And I have heard of programs in the city before of registered dietitians who are being based out of the grocery stores to really talk to folks about the choices that they're making. And I think that's a really wonderful way of accessing people where they are and making it easy for them to make those choices.
I agree.
I think this leads to another question that we just got. It says, are any of your respected organizations partnering with the local or state level governments or government to address the issues mentioned? If so, what initiatives?
So actually, I'm going to speak to that in just a little bit, but I can give a preview of it. We at the AHA have a very strong advocacy program, and we work at both the state and local levels to support legislation that helps create healthier communities. So to the questioner's point, it's not just working from the ground up, but also looking from a kind of a let's call it 10,000 foot level to try to really affect some of the programmatic things that can be impactful, like CPR in the schools and healthy food in the classroom and so on and so forth. So yes, absolutely, AHA is very involved with a robust advocacy program at the governmental level.
Here at Temple, we've created
Go ahead,
here at Temple, we have maintained some public parks on our own to kind of help out on the local side of things. Similarly, we do food drives where we have just a lot of farmers market fresh produce available. So we've contacted our local communities to kind of help, spread the word and do our part.
And again, I think our legislators are key, okay, with regard to each one has a district and people, and it goes down to the vote. You need to, again, vote for folks that are going to enhance your lifestyle, whether it's the city council, whether it's the state, or whether it's even the federal level. And again, at Independence, we have a whole government relations team that's diligently working to change some of those systems that are in place to ensure, again, that people get healthy food, that that the legislators are doing the things that they need to do. So I think it's a combination of partnerships and everybody getting on the same page, and how do we do this together? And we can beat, I often say we can beat COVID together. I believe we can do the change legislation, change communities, make things better together as opposed to apart.
Great. And as a multi-service organization, Congresso has over 40 different programs that are addressing all of the things that we talked about that, are either social determinants of health or adverse childhood experiences, ACEs. And, we have federal contracts, state contracts, city contracts, private foundations, and they all work together to really address all of the things that we're talking about here today.
Yeah.
And I just want to bring up Dr. Kala. She mentioned community gardens. I was actually at a community garden that Temple students are responsible for in the area in North Philadelphia. And that was a great experience because you can actually grow your own produce and you teach the community, and the Black and Latino community can have access to fresh produce and see the whole process. So that was really interesting. And it goes to your point of maintaining a healthy lifestyle and learning about it and the resources. How can you changes that you can make. So it was a great experience there as well.
I think that goes back to, again, not show them how to fish so that they can, not to get biblical, but, so that they can, be empowered, I think, more than anything else.
And so the next question is, this is a good one. What's something simple that everyone can start doing today to help combat health disparities?
Exercise. I'm teasing. I think exercise is one of them. Okay, I think I never thought I would look at labels, starting to look at labels on different foods and things that you minimize your sodium intake. I think we have to take charge of our health, even if it's little by little. But I think something easy, again, walking 30 minutes a day with regard to getting your endorphins and all those wonderful things moving. It is, I think, educate, okay? Find out as much information as you can about being healthier with whether it's Congresso or others that are right there in your community. They have great information and programs that can help you get healthier. So those are just a couple quickies for me.
No, I would agree with those, Lorena. The other thing, if I'm not sure I understand the questioner's perspective here, they may be looking more broadly at like how can they get involved with healthcare disparity resolution. And if that's what they're talking about, really, I think just this program is trying to make people aware, to be aware of it. When you hear about legislation, call your congressman, call your state representative, make certain that you make your voice known. Those are things that are meaningful and do have impact. As you can tell, it's a large problem, so no one person can do all of it. No one organization can do all of it. But I think this kind of program and others make awareness important component, because you can't be active unless you're aware of it. One of the sad facts about Philadelphia is that if you live in Society Hill, your life expectancy is 20 years longer than if you live 4 miles up the road where Adita goes to work every day. It's quite remarkable. And just being aware of these disparities within our own community and understanding what contributes to them. And again, from a population health standpoint, it's things like environmental toxins, it's things like crime rates, it's things like school education, health education, access to healthy care, access to health organizations, access to pharmaceuticals. All those things contribute. So if you have any impact on any one of them, you will have a meaningful impact on healthcare disparities.
I think that's a great overview of what you can do from, on a large scale thing. And for yourself personally, I think please go see your primary care doctor or whatever your healthcare provider is and screen yourself. I often hear like, oh no, I don't have diabetes. You're not sure. Just go make that appointment today. See your doctor, get your cholesterol levels checked, get yourself screened for diabetes, and get your blood pressure checked. That one office visit will potentially really reduce your chance of developing heart disease down the line.
Yeah, walk to the doctor's office too. That'll be better than taking.
There you go.
Yeah,
I agree with all that. And I think, one thing, if you're a community member who's watching, check in on your friends and neighbors. If you have access to resources, share those things with people. Let them know about the congressos of the world and other places that they can access support and really share those resources and be a promotora of health.
So the next question, what role does community development play in helping to create health equity?
I mean, it's everything.
Yeah.
If we didn't have such disparities in our communities in terms of all the access points we've been talking about throughout the broadcast, we wouldn't have many of these issues at hand. So community development is critically important. And by that, I mean, trying to get people employed, try to get them educated, try to get them access to healthy foods, putting places in the community where they can get those access points. So absolutely, the community development is key. It's a slow work. It's God's work, but it's important.
And the following question, when educating patients, is the information presented at a specific grade level and culturally translated?
Yeah, so I think at least I can speak for myself, but I do believe most of the physicians, even in my practice, and I'm sure across the board, one of the key things is that you got to be able to communicate it in a way that makes sense. So you're not using a lot of medical jargon. You're not using terms that you would have to look up to understand. Again, going back to what I'd mentioned earlier about having goals that are small incremental goals to achieve, and not what I did when I first started my training about hydrogenated oils. So yes, I think how you communicate it is definitely very important. There was a second part to your question that I've already forgotten. I apologize.
Yes, and culturally translated.
Oh God. So you know what? I really appreciate whoever asked this question. I do think that sometimes from a cultural standpoint, people tend to either underplay or sound very enthusiastic about the way they describe their symptoms. And I give a lot of credit to physicians these days for being more aware of that and to take away maybe the way in way it's said and take just the content, because I think that does improve, providing better care. And I want to give a huge shout out to all of my nurses and everyone in the hospital staff during the COVID time specifically. Previously, again, being in the North Philadelphia area, we do have a lot of patients who are predominantly Spanish speaking. And prior to COVID, we had interpreters who were here in the hospital who walked in with you every time you needed to speak to your patient and interpret it. And we don't have that now. With COVID, we're not allowing the extra people in. So you have to call a 1-800 number, stay on hold forever, and then hope to get connected to an interpreter after giving away your social security number. And then you go into the room. And I will tell you, I have witnessed my nurses just to give one extra pill will take out that time to make that call so that they understand exactly what that one pill is. And it is time consuming. It can be frustrating when you suddenly got disconnected after waiting on hold for a long time. and they do it. And I that has been, I appreciate everyone bringing up awareness of these cultural differences, because I think I'm seeing a huge difference inside the hospital.
And I just, again, joined both docs. And when I think about, when we look at the 60 clinics and FQACs that we support, we try to make sure that they're culturally diverse. So that, for instance, the J Zone is Asian. So therefore they have somewhere they can go where there's a comfort level, people understand them. I mean, I'm amazed that in some communities that they have 40 or 50 different languages that are there. So when you start to interpret and you start to translate, you really need to have somebody there that can help you with that. So I think that's just super important, super important.
And I agree. And you know, the Congressional Health Center, we have 17 staff within our FQHC, and all of them are bilingual, bicultural, and most of them actually come from this community that we are in. So that really makes folks feel comfortable about accessing their healthcare here. They know that their doctor is going to speak their language. They know that they're going to understand the foods that they eat and the celebrations that they have in their family that affect their health. And they know that they're coming to a place where people understand them and have often grown up in the same, you know, with the same lifestyle and conditions that they have. So that really helps a lot.
So I just want to add to what Dr. Kala said regarding the translating, and you've just brought up from a child who's been translating from my parents my entire life. I know how important it is to translate into Spanish or into any other language the meaning of what someone's telling you, because it makes a huge difference in that aspect, in that regard, especially when it comes to your health. So thank you so much, all of you, for the work that you've been doing in our community, many communities of color as well. So thank you so much. So I want to, before it's noon already, so we're almost at the end of this great roundtable discussion. So I want to open it up to our panelists. Any final thoughts before I turn it over to Dr. Gray? Any final thoughts that you may have?
Thank you guys again for having this platform for us to be able to discuss this and bring about the awareness. I think this is definitely a key part of improving health disparities. So thank you again.
I'd also like to say, again, I think of a quote by Dr. Maya Angelou, where she says, people will remember what you said, won't remember what you did, but will always remember how you made them feel. And what I think is so important, that no matter what your zip code or where you live, that you'd always feel that you are important and that your voice does matter. So that's what I want to say.
Agreed. Thank you. And, you know, in my opinion, I really do think that the single most important thing that we can do to address, you know, inequity in healthcare is really addressing the social determinants of health and making sure that folks have access to things like healthy food, adequate housing, social service supports, all of those things that they really need to be able to improve both their physical and their mental health.
Yeah, I think, you know, I know I'm going to have a couple of words at the end here, but one of the kind of overriding things that I always remember is that people don't lack energy or intelligence. They only lack opportunity and organization. And I think that's what you're seeing here. All the efforts are really towards providing opportunity, organizing around some of these important issues. And so we think that that'll engage the communities that we serve.
And Dr. Gray, like you said, we want to hear from you regarding the American Heart Association and the work that it's doing with like-minded organizations and the government. I think you've mentioned this already, and to change systems and policies that will improve health equity and quality of care for all Philadelphians.
Yeah, I mean, I think I want to pick up on it. We've talked about many themes here, but I want to pick up on the childhood theme when I answer this question. We know that people who attend preschool are more productive in their lives at school and at work and generally in society as adults. And they have higher levels of education and earnings and less involved with delinquency, crime, and fewer chronic health problems, not surprisingly. So that early childhood education is really important. It serves as a foundation for a longer, healthier life, which is the goal of the AHA. And so starting kids off with a solid pre-K education and setting them on the right path, it's changing the trajectory of the well-being of Philadelphians broadly. So the AHA continues to support the city's increase of 700 Philadelphia pre-K seats for a total of 4,000 seats in over 130 centers in Philadelphia. And these Philadelphia pre-K seats are funded by the Philadelphia beverage tax, and many people may not know that. This is a sugary beverage tax that actually goes to preschool education. And it offers this high quality early education, which specifically targets neighborhoods where priorities are lacking and have lacked quality options before, and gives them, kind of takes them out of this educational desert. And for me, it's one thing to counsel an adult who has a set lifestyle, who's already developed some habits that are difficult to break. But when you can get to the children and educate them early, not only do those children grow up to be more productive and healthier adults, but they also affect the adults that they live with. So this is critically important, and I think an effort that the AHA continues to advocate for, so that we can improve the health outcomes for all Philadelphians, especially in the under-resourced communities.
And Dr. Gray, how can the public support the efforts of the American Heart Association?
Well, we spoke a little bit about this before, Yaima. As I said, the American Heart Association has a robust advocacy program. We're continuously supporting legislation at the state and local levels that helps create healthier communities. Somebody spoke about community development earlier. For an example, the AHA advocates for healthier meals for kids in schools, clean air bills. We didn't talk much about toxic environments, but that's a real issue. CPR education in the schools. You may know that today in Pennsylvania, you have to graduate, in order to graduate high school, you have to have a CPR certificate. That's an important development. We were not the first state to do that, but I'm happy to report we're finally on that train. And if you're interested in getting involved with this kind of work with the AHA, please go to the website, You're the Cure. It's YOURE, The Cure, no apostrophe, and register, and we will provide you the information you need to get involved with advocacy at the legislative level. And about CPR, since I brought it up, we are today or this week celebrating CPR and AED Awareness Week. AED is automatic external defibrillator. It's time that we really broadly recognize the benefits of community CPR. In Philadelphia, we have a CPR rate, if somebody were to have a cardiac arrest on the street, of about 15%. That's far below the national average in cities of our size. And so it's important to note that this disparity in delivery of bystander CPR affects our communities. We also know that, and as a study was done by CHOP, that if you look at white children versus folks in non-white communities, CPR was 41% less likely to be delivered in a non-white community. And this is really a horrible statistic because it's a life-saving intervention. Black children living in mostly Black communities with high unemployment, low education, low median income were almost half as likely to receive bystander CPR compared to white children. Again, this is the future as our children. So we can do better. We can do a lot better, not just in those communities, but as Philadelphians in general. If you want to get CPR education, hands only, you don't have to touch anybody's lips. You just do your hands, and you can save a life. You go to cpr.heart.org, cpr.heart.org, and learn CPR. It's really easy. You never know who you're going to need to save. It could be somebody sitting next to you. It could be a family member or a loved one. So I'll end up with that, Yaima. I really appreciate the opportunity to be here, and I'm in awe of the work that the folks on this call are doing every day. It helps the AHA advance their mission, and I want to thank each and every one of them. And thank you.
Thank you.
Thank you, Dr. Gray, and thank you to everyone. This concludes our roundtable today. Thank you so much for being here, for that information. Everything that you've shared is so important in our communities. And thank you for everyone who joined in the Health Equity No Matter Where You Live roundtable. So thank you so much to everyone, and we'll have a great day. Thank you so much.
Thank you.
Take care.
Bye-bye.